Hey everybody, this is Dr. Ben Pearl with FitFootU. Today we're going to be talking about mucoid cysts. There's a lot of folklore about mucoid cysts, mostly spread by a common YouTube show out there called the Pimple Popper. The idea is that you remove the sac and that's the end of it. It doesn't exactly work out that way in the foot, and here's why. We're going to pan up right close to the second toe here. This is where the mucoid cyst is, and in this case, we can drain it and that's fine. But as soon as there is pressure right there, it'll form again. But we're going to take care of this problem right now. So here's the toe. We have a mallet toe, and what's happening here is it's kissing into the first a little bit. You wore a shoe. That's the main problem, the culprit. The vamp of the shoe put pressure at the distal end of this middle phalanx. And the phalanx, right at that area, it creates a joint with the distal phalanx, and then you get the outpouching of the cyst, the outpouching of the synovial sac. So what we're going to do is, it's already been prepped with iodine. We're going to put a little cold spray right there, and we're just going to get a 25 gauge needle so it's not too abrasive, hopefully, right? And we're going to do a couple, and you can already see it's a little sticky there on the close-up. That is the primordial ooze, just like the alien stuff that came out of the ship and disintegrated the decks of the ship. We have this synovial cyst-like fluid in all the joints. The problem here is it's just a little bit more than you would want ideally, and hence creating this. Now, if we were looking longer term at this, then what we could potentially do is remove the knuckle of the bone. Right now our patient's traveling, so it's not an optimum time, so we're just going to make this more comfortable, and it might be 2 months, it might be 6 months, it might be 2 weeks when some recurrence of this cyst will come back, but we're going to drain it to the best of our ability. We're going to score it again here at the base, and it's not hurting too much, but the pressure does hurt a little bit, and then again we can see the gelatin-like synovial fluid coming out. And we're going to keep doing that, and sometimes it'll take a minute to have the next little pocket of the synovial fluid drain. You do have to apply pressure, and then sometimes there's like little subcompartments of the cyst. So we're going to do one more on this side, and then this should be pretty much a done deal. Now, the aftermath of this is going to be compresses, warm compresses. There's no major immune compromise here, so we don't need to prophylact with any antibiotics. I'm going to clean this up a little bit, and we can see it's already reduced probably about 60% to where it was. And what's going to happen is, as time goes on, this remaining stuff is going to continue to drain, this remaining synovial fluid, as long as the portals are open. We're going to do just one more where it's tight right there, just to get that last little bit drained out. Yep. Okay, so the expectation is that we're going to get some relief out of this for a while, and then at such point when we want to do more permanent relief, then we could talk about removing a small portion of the knuckle of the bone, but that's a longer term recovery, and we'll cross that bridge when we get there. All right.